The topic of our study was remote digital diabetes monitoring. This is a really diverse clinical intervention that may be made up of different monitoring tools and different ways of adapting patients' treatment based on their monitoring data. So what my colleagues and I tried to find out is which remote monitoring modalities are seen as most intrusive to patients' private lives and why. Hi, I am Theodora Economidi and I am a researcher at the University of Paris. I'm the author of the study, an international mixed method study of the perceived intrusiveness of remote digital diabetes monitoring that will appear in Mayo clinic Proceedings, along with my co-authors, Professors Ravo, Tran, Couson, Montori, and Dr. James. We did a vignette survey to find that out in which 1,010 people participated from 30 different countries. Our participants had type 1 or type 2 diabetes. What we found is that patients with diabetes view specific modalities of remote monitoring as more intrusive than others. The modalities that are seen as most intrusive are having to monitor one's food intake, as opposed to monitoring only one's physical activity and glucose levels. Also, having one's monitoring data managed by a private company was seen as more intrusive than having their data managed by a public organization such as a public university or a public hospital. Finally, in terms of receiving feedback to adapt one's treatment, what was seen as more intrusive is receiving real-time feedback by a healthcare professional, for example, via phone call or message, to adapt one's treatment or lifestyle based on their monitoring data. This was seen as more intrusive than discussing one's monitoring data in the pre-scheduled consultations every 3 or 6 months and adapting their treatment at their doctor's office. It was also seen as more intrusive than having their treatment adapted by an algorithm, by a suggestion appearing on their device produced by an automated AI. By analyzing participants' responses to our open-ended questions, we found that these modalities were seen as more intrusive primarily because they were considered very burdensome. For example, logging one's meals as you're about to sit down with your family for dinner. It is seen as very disruptive and, if done frequently, can be very tiresome. Moreover, some participants in our study felt that being contacted with advice to adapt your treatment in your daily life might be a loss of their autonomy to adapt their own treatment as they see fit, and a loss of their control over their health and their diabetes management. What this means for clinical practice is that healthcare professionals who prescribe such remote digital monitoring systems to patients with diabetes should have careful discussions with their patients based on the principles of shared decision making. And through these discussions, they can help their patients identify the modalities of remote monitoring that best fit in their lifestyle and that best fit their values. They can also spot any barriers in the use of remote digital monitoring and help their patients solve such barriers. In terms of future research, these are preliminary findings and experimental studies are needed to further confirm them. Moreover, we need longitudinal studies. Longitudinal studies will examine what happens once patients have adopted remote digital monitoring tools, how intrusiveness changes over time, and how it may affect their adherence to the recommended use of remote digital monitoring.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.